Medical Chemistry. Biochemistry. Study Guide Part 1. General characteristics of vitamins. Fat-soluble vitamins. Qualitative reactions on fat-soluble vitamins. Tests for self-control solutions. 1. The signs of rickets are observed in children with hereditary renal disease. Vitamin D concentration in the blood is within the normal range. What of the below mentioned is the most likely cause of rickets? A. Increased calcium excretion from the body. B. Hyperparathyroidism. C. Hypofunction of parathyroid glands. D. Impairment of calcitriol synthesis. E. Insufficient intake of calcium from food. 2. Linoleic and linolenic acids are necessary for the synthesis of eicosanoids. The main source of these acids is alimentary factor, biosynthesis of fatty acids, cholesterol degradation, D-microsomal oxidation, oxidation of fatty acids. 3. Which vitamin has antixerophthalmic action? Vitamin D3, vitamin K, vitamin A, D. Vitamin P, vitamin C. 4. A few days before the operation, the vitamin K or its synthetic analog Vicosol is prescribed to the patient. What type of post-translational modification reactions of 2, 7, 9, X blood coagulation factors is performed with participating vitamin K? A. Carboxylation. B. Decarboxylation. C. Deamination. D. Transamination. E. Glycosylation. 5. Under the influence of ionizing radiation or avitaminosis E, the increased lysosomal membrane permeability is observed in cell. What consequences may result from such pathology? A. Intensive generation of energy. B. Intensive synthesis of proteins. C. Partial or complete destruction of cells. D. Renovation of the cytoplasmic membrane. E. Division spindle formation. 6. Which vitamin, because of the hydrophobic side chains, is integrated in the phospholipid matrix of biological membranes, stabilizes them and serves as a powerful bioantioxidants? A. Tocopherol. B. Vitamin. C. Vitamin B6. D. Nicotinamide. E. Cyanocobalamin. 7. To the patient with periodontosis, the doctor prescribed the vitamin A applications. Which process activation under the influence of vitamin A provides the healing process? A. Carboxylation of glutamic acid. B. Dark vision. C. Color vision. D. Proline hydroxylation. E. Cell growth and differentiation. 8. Which vitamin hormonal form induces the synthesis of Ca-binding proteins in enterocytes at the genome level and thus regulates the intestinal absorption of calcium ions necessary for the formation of dental tissue? A. D3. B. B1. C. E. D. A. E. K. 9. Nyctalopia, night blindness, is observed in a patient. Which of the below mentioned substances will have a therapeutic effect? A. Keratin. B. Creatine. C. Carotene. D. Carnitine. E. Carnosine. 10. A patient complains of loss of appetite, headache, and insomnia. Hyperkeratosis, inflammation of eyes, loss of hair, general physical exhaustion are observed. It is known from anamnesis that the patient has been consuming cod liver oil during a long time. What is the cause of this state? Hypervitaminosis of vitamin D. Hypovitaminosis of vitamin D. Hypervitaminosis of vitamin A. D. Hypovitaminosis of vitamin A. Hypervitaminosis of vitamin F. 11. Symptoms of K. Hypovitaminosis. Thromboses. Subcutaneous hemorrhages. D. Dentition, shedding of teeth. D. Increased blood clotting. Dermatitis. 12. The mother of breastfed baby complains of baby's insomnia, frequent weeping, irritability, disposition to sweat, bald back of the head. Which disease may be diagnosed? Scurvy. Rickets. Beriberi. D. Pellagra. Anemia of Addison-Bermer. 13. A newborn has symptoms of hemorrhagic disease due to hypovitaminosis. K. Development of disease is explained by the biological role of vitamin K, namely A. It is a cofactor of prothrombin. B. It is a specific inhibitor antithrombin. C. It influences the proteolytic activity of thrombin. D. It is a cofactor gamma-glutamate carboxylase. E. It inhibits the heparin synthesis. 14. The possible anti-cancer activity of two fat-soluble vitamins is associated with their antioxidant properties. Point out these vitamins: A and K, B and K, C and K, D and E, E and E. 15. During an examination of the child, the doctor found signs of rickets. Which substance deficiency in the child's body contributes to the development of this disease? A. Naphthoquinone. B. 1,25-dihydroxycholecalciferol. C. Tocopherol. D. Retinol. E. Biotin. 16. The therapy with vitamin preparations was prescribed to pregnant women with numerous spontaneous abortions in the anamnesis. Which vitamin facilitates the normal proceeding of pregnancy? A. Alpha-tocopherol. B. Folic acid. C. Cyanocobalamin. D. Pyridoxal phosphate. E. Ruthin. 17. Osteoporosis developed in the woman with chronic kidney disease. Deficiency of which of the below-mentioned substances is a major cause of this complication? A. D3. B. 1,25-dihydroxy-D3. C. Cholesterol. D. D2. E. 25-hydroxy-D3. 18. Delayed teething. Their wrong location is marked in the child. There are also complaints on dry mouth, cracks in the corner of the mouth with further suppuration. Which vitamin deficiency can lead to this state? A. B. D. C. C. D. E. E. K. 19. The child has the pronounced signs of rickets. Digestion was not disturbed. The child is in the sun a prolonged time. Within 2 months, the child receives vitamin D3, but manifestation of rickets has not decreased. What can explain the development of rickets in the child? A. Disorders of calcitonin synthesis. B. Disorders of parathyroid hormone synthesis. C. Disorders of calcitriol synthesis. D. Disorders of thyroxine synthesis. E. Disorders of insulin synthesis. 20. Patients with bile duct obstruction have hemorrhages due to bad assimilability of vitamin F, vitamin A, vitamin E, D. Vitamin D, vitamin K. 21. A complex of vitamins with vitamin E is recommended to old persons. What is the main function of this vitamin? Antiscorbutic, antihemorrhagic, antioxidant. D. Antineuritic, antidermatic. 22. It is known that dicameral administration to organism causes a sharp reduction of blood levels of prothrombin and other blood clotting factors. Dicameral is antivitamin of A. Vitamin H, B. Vitamin C, C. Vitamin E, D. Vitamin P, E. Vitamin K. 23. The physician found the increase in time of the patient's eye adaptation to darkness. Which vitamin deficiency may be the cause of that symptom? Vitamin E, vitamin A, vitamin C, D. Vitamin K, vitamin D. 24. Treating the child with rickets using vitamin D3 did not give a positive result. What is the most likely cause of ineffective treatment? A. Lack of lipids in diet. B. Impairment of hydroxylation of vitamin D3. C. Impairment of the incorporation of vitamin D3 into the enzyme. D. Improved use of vitamin D3 by intestinal microflora. E. Impairment of vitamin D3 transport by blood proteins. 25. The patient has night blindness, dryness of the conjunctiva and cornea. Such changes may be the result of the deficiency. A. Vitamin A, B. Vitamin B1, C. Vitamin C, D. Vitamin D, E. Vitamin B12. 26. Vitamin D deficiency in children causes a disturbance of calcium phosphorus metabolism, osteomalacia, and rickets. Calcitriol regulates the absorption of Ca2+ ions in the intestine through the induction of the synthesis. A. All mentioned. B. Ca2+ dependent ADPase in myocytes. C. Na/K ADPase in the enterocytes. D. Ca2+, binding protein in enterocytes. E. Ca2+, colmodulin in enterocytes. 27. Which hypovitaminosis manifests by the disturbance of reproductive function of organism and muscular dystrophy? Vitamin B1, Vitamin A, Vitamin K, D. Vitamin D, Vitamin E. 28. The child has the intestinal dysbiosis, which led to development of hemorrhagic syndrome. What is the most likely cause of hemorrhages in this child? A. Deficiency of vitamin A. B. Activation of tissue thromboplastin. C. Hypovitaminosis pp. D. Deficiency of fibrinogen. E. Hypocalcemia. 29. One of the mechanisms of vitamin K action is its participation in the enzyme system of gamma carboxylation of protein factors of blood clotting, bone, and the tooth mineralization that increases the affinity of their molecules to calcium ions. Which amino acid is carboxylate in proteins? A. Serine. B. Valine. C. Phenylalanine. D. Glutamic. E. Arginine. Thank you. Hope to see you soon. Subscribe, share, like, comment. Remember, I am G2.